So Dr. Battistone is the newest addition to our team. She grew up near Steinbach, Manitoba on a hobby farm, which is what fostered her love for animals. She was a 4-H and a pony club member and spent most of her time showing and training horses in many different disciplines. She also ran a mobile petting zoo business, which I think is really cool, when she was in high school, which featured a variety of farm animals from miniature horses and calves to alpacas and pygmy goats. After earning her animal science degree at the University of Manitoba, Bretley was accepted to the Western College of Veterinary Medicine, where she graduated in 2013, and then began a large animal theriogenology internship at the WCVM. And theriogenology is just the fancy word for reproduction. She spent the year working in the reproductive department. Sorry, jumped the gun. Bretley's main area of interest is reproduction, but she also enjoys all aspects of equine health. Outside of veterinary medicine, Bretley enjoys exploring the great outdoors and making music on her piano or guitar, or spending time with her cat and husband, Tony and Anthony, respectively. And I'm not sure if it goes in that order, cat and husband, or not. All right, take it away, Bretley.
Okay, I think we're all organized here. All right, welcome everyone. It's great to see so many people out tonight, and I'm really excited to talk about the other end of the horse, equine reproduction. So first of all, a lot of people will wonder what the big deal is with equine reproduction. Why do they need so much help reproducing? You know, why can't we just put in a mare and a stallion out in the pasture, let them do their thing, we have a foal in the spring, right? If you look at cattle, that's often the case. But for instance, cattle have been selected for reproduction or for fertility for a long time. If a cow doesn't produce a calf in the spring, oftentimes it's off to market with you, right? But with horses, we're often selecting for other things like performance, looks, or speed, all sorts of other things, and fertility doesn't often come into the equation. So if you look at a typical herd of wild horses nowadays, their fertility rate's actually only about 50%. With today's technology in a clinical setting, sometimes we can reach up to 90%, and oftentimes that's breeding horses that are considered to be subfertile by nature's standards. So here is a chart of the cycle, and I'm going to be doing a quiz later, so take notes. But the basics of this, basically, horses are long day breeders, so that means that they come into season as the days start getting longer. The fancy word for that is that they're seasonally polyestrous. So at a certain season, they start coming in, they cycle several times and ovulate, and then they go out of season. And in between those two seasons is called their transitional period. And that can be when things are quite unpredictable. So just a summary, the typical estrus cycle is 21 days long. And during that time, they have a 3 to 7 day estrus period. And during that time, they show signs of estrus. And when they're not in estrus, they're producing progesterone, which prevents them from showing those signs. They ovulate near the end of that estrus period, and within about 24 hours, they'll stop showing signs of estrus. So during the time when they're not showing signs of estrus, their ovaries are producing follicles, and those follicles grow large and then ovulate. Once they ovulate, a CL, or a corpus luteum, is produced, and that's the progesterone-producing structure on the ovaries. I know that's a lot of information, so what do we really need to care about? And that's the signs of estrus, or mapping our mare's cycle, and that can tell us when to bring the mare into the clinic or when she's ready to be bred. Some of the typical signs of estrus are urination, or more frequent urination, especially in the presence of a stallion or a new horse. Winking, that's winking the vulva. And then attitude changes. And so a lot of mare owners will tell you that the attitude of their mare certainly changes when they're in estrus, and they may not be as agreeable or not focused on the same thing as the rider all the time. Right. Sorry, just getting organized here. So what affects fertility? There are several things that do, and I've just kind of summarized the main 5 things. So age can certainly affect fertility of a mare. After about 8 years old, the fertility actually starts to decline, and it doesn't drop off until about after 18 to 20 years old. So we're often breeding horses late into their teens, but the fertility isn't as optimal at that time. Also, if they've had a history of abnormal foalings or unexpected abortions, that can decrease the expected fertility of the mare. A history of normal foalings actually can increase the fertility. If a mare is severely underconditioned or undernutritioned, her cycles actually become quite irregular, and so the conception rates can decrease. Obviously, season plays a part of it, as I already mentioned. So if the mare is transitional, going into or coming out of season, then her fertility will be lowered. Stress can also play a part of things. If a mare is undergoing severe stress, then she's not going to cycle normally either. So what are some of the reproductive technologies that we use at the clinic to help get mares pregnant? And so the breeding soundness exam is a great tool that we can use, especially when we are unsure of the mare's reproductive health or history, but we'll talk more about this a little later. The first tool that you'll usually see us use in the clinic is the ultrasound machine. And the ultrasound machine has become a staple of the breeding shed because it allows us to accurately follow ovarian activity. And it can help us to better understand when the mare is close to ovulation. So we'll look at the size of the follicles, whether or not a CL is present, whether there's edema in the uterine lining or fluid in the uterus, which is always abnormal. So on the left, I have a picture of an ovary. There are several follicles on this ovary, which are the black structures. And so those structures grow. And at one point, one of them becomes dominant, or becomes the dominant follicle, and that one goes on to ovulate. So on the right, this is after ovulation occurs. There is a structure in the middle of this ovary, and that's the CL. It produces progesterone. It helps to maintain a mare's pregnancy if she does become pregnant. And if she's not, it eventually goes away to make way for another dominant follicle to come and ovulate. So other reproductive technologies that we have are injectable agents or oral agents as well. So some of these agents, such as prostaglandin, for example, help to shorten a mare's cycle, and we can bring her back into heat more quickly after, say, an unsuccessful breeding attempt. Others, like oxytocin, is more of a therapeutic agent that helps to contract the uterus and clear it of excess fluid. There are still others that help to induce ovulation. So if we have a dominant follicle, a big one that's ready to ovulate, we want to make that a little bit more predictable. So some of these drugs can help us to make it a little bit more predictable, and so we can order semen or time our insemination a little bit more accurately. So a third technology that we have is intrauterine treatments. And so this is a practice that we utilize commonly in the breeding shed. When a mare is bred, basically we're putting foreign material into her uterus, and so naturally there's a reaction to that foreign material. A normal mare with a normal immune system is able to clear that reaction in about 24 hours. Some mares, they can have an abnormally tight cervix, which fails to relax properly during estrus, and that fluid is unable to drain and accumulates in the uterus. Once the mare is bred, the fluid accumulation is aggravated, and we can have impaired uterine contraction or poor drainage from the uterus, and the tight cervix compounds things. So the amount of intrauterine fluid will vary in individual mares, and it can range from a few milliliters to about over a liter in extreme cases. So the treatment we use for this is to introduce a catheter into the uterus. We flush it with saline and clear the uterus, and this is often done in conjunction with oxytocin injections. This fluid accumulation is considered is known as post-breeding endometritis, and if the condition is particularly troublesome, it can even warrant treatment with intrauterine antibiotics. Mares that require these types of treatments are known as susceptible mares, and are often require tight regulation of their cycle to achieve pregnancy. So the last mare reproductive technology that I want to talk about is embryo transfer. This is the practice of breeding one mare, which we call the donor, and then we place that pregnancy into another mare called the recipient. In this way, the mare can produce more than one foal per breeding season, or we can perpetuate her genetics without her having to carry a foal. Many breed registries accept this practice, but it's important to check that your breed registry recognizes embryo transfer foals before getting started. This method of reproduction can be quite optimal for a few different types of candidates. Firstly, the competition mare. These types of mares can be bred, flushed of an embryo, and have it transferred to a recipient, and then go back to competition or continue training for the following competition year. Some owners choose to provide several recipients for their competition mare, and then give her the breeding season off in the hopes of producing more than one foal for the following year. The second candidate could be a susceptible or subfertile mare. And some of these mares are perfectly capable of conceiving an embryo, but due to the excess intrauterine fluid or uterine pathology, the mare may not be able to carry the pregnancy to term. In this case, after a subfertile mare is bred, the embryo can be transferred to another mare and that has a healthy uterus so that she can carry the pregnancy. So the Coles notes for the process I put up there, and that's that the donor mare is presented with at least 2 recipients. Their cycles are then synchronized, and the donor mare is bred. 7 to 8 days after ovulation, the embryo is flushed from the donor mare, and then washed and deposited aseptically into the recipient mare. And this process can be repeated throughout the breeding season. So on the right there, that square at the top right there, it's actually 1 millimeter by 1 millimeter, and that's a 7 to 8 day embryo right in the very top middle there. So that just helps us to appreciate just how small it is at 7 to 8 days. It can sometimes be quite difficult to find, but it is very rewarding to find one. So I did want to talk about stallions. We can't forget about the other half of the equation. And having a stallion can be quite an undertaking, so it's something that needs to be researched and prepared for in advance. But there are certain things we can help you with, though, and stallion handling is one of them. It's possible to have a respectful stallion, believe it or not, but it needs to start from an early age. Stallions certainly look forward to being collected, and they do often begin to associate the handler with being collected. So at the clinic, we are happy to handle stallions on a regular basis, so if you are looking for support in this area, we are more than happy to help. We also perform breeding soundness exams on stallions, including internal and external examinations of the reproductive organs, and most importantly, a full semen evaluation, including the motility, the concentration, and the morphology. Progressive motility covers the actual forward movement of each sperm cell, and concentration covers the actual output numbers that the stallion is capable of. To evaluate morphology, we stain the individual sperm cells, and then we look at them under the microscope to determine if they are of normal shape. There are several types of abnormalities a sperm cell can have where they're still capable of moving forward, but they wouldn't be capable of actually fertilizing an ova, and this can provide valuable information to us about the individual stallion. So we also routinely stand stallions at the clinic, and so we are capable of collecting a stallion for cold shipments or fresh inseminations. We will evaluate, extend, package, and ship the semen all from the clinic. There are several types of semen extenders on the market, and we can also help you to determine which one, when added to the stallion's collection sample, can provide the sperm cells with the longest lifetime and therefore the best motility and, in turn, fertility rates. We also can freeze semen, And that's an extra service you can provide to your potential buyers as a stallion owner. Some owners choose to freeze several doses of semen for future use, and then they can geld the stallion afterwards. So, I've just given you a whole lot of information. Where do you begin if you're interested in breeding your mare? Firstly, where we would start is before bringing your mare into the clinic, you want to make sure that she's healthy, she's at a good body condition score. It's also a good idea to deworm her and provide her with spring vaccinations before bringing her into the clinic. A breeding soundness exam is a great tool that we can use to help evaluate her fertility. And this is especially important when there's a reason to believe that your mare's fertility may be questionable, or it's a great baseline to have before the breeding season even begins. Part of the mare's breeding soundness exam is that we take swabs or cytologies of the mare's uterus, and we will also take a biopsy, which is sent away to be graded by a pathologist. The grade corresponds to an actual percentage potential conception rate. At this time, we would also look at your mare's external reproductive characteristics and whether or not she would be a candidate for a Caslix procedure. This is a fairly routine procedure, and it involves shortening the opening of the vulva to prevent introduction of foreign material or bacteria, and also helps prevent urine pooling. The Caslix is then removed 1 to 2 months before the mare is due to foal. So, where to begin with the stallion? Where I suggest beginning is with looking at the different types of AI that stallions can offer. Not all of them offer all three, fresh, cooled, and frozen, so it's important to look at what the stallion offers. Fresh semen is collected and inseminated into the mare immediately, and this method typically has the highest fertility rates, but cool shipped can also be similar. This obviously means that the mare has to be either on the same property or at least very close, as the semen motility rapidly begins to decline after as little as 10 minutes outside the stallion if it is not extended. Cooled semen, this is when the semen is collected, extended, cooled, and then shipped. And it's shipped in a specially designed container, and usually it can be shipped to anywhere in North America. This opens up your stallion selection substantially without significantly impacting the fertility rates, assuming that the semen quality is good. The disadvantage of this method is that timing is quite imperative. Once the collection is shipped, our optimum insemination time is only about 24 hours. This means that the mare must ovulate within a given window, and the stallion must be available for collection in that window as well. This can especially become challenging when the mare comes into heat on the weekend or the stallion has an extensive showing schedule. These are useful questions to ask the stallion manager. Frozen semen. So this method takes timing with the stallion completely out of the equation. The semen is waiting in the liquid nitrogen tanks until the mare is ready to be bred. At that time, we can thaw and inseminate the mare. This method also really opens up our stallion options. Not all stallions have frozen semen available, but we are now able to choose from stallions around the world. The disadvantage of this method is that the equine frozen semen market is largely unregulated, and although stallion managers certainly want to achieve good pregnancy rates, a lot of frozen semen does not come with a post-thaw analysis and may have questionable quality. But regardless of the method you choose, we always do a full evaluation of the shipments we receive, and we'll be able to discuss with you our semen quality findings. This is the point at which it is a good idea to discuss fertility with the stallion manager. Remember how I said at the beginning that stallions have never really been bred for fertility. So don't be afraid to ask about the pregnancy rates that have been achieved with the particular method, fresh, cooled, or frozen, that you have chosen for that stallion. It is certainly better to have the answer now instead of later. So, we know where to begin. Now, when should we begin? That all depends on when your mare begins to cycle normally. Like I mentioned briefly earlier, we can advance the progression into normal cyclicity by a few different means. One of them is placing the mare under artificial lighting in order to trick the mare's brain into thinking that the days are getting longer. There has to be some forethought with this, as it does take some time for the mare to respond. But this is quite a common method used by owners that are hoping to get a foal early the following year. This can be useful for owners who are hoping to show the foal as a yearling or a 2-year-old, when a few months can go a long way for maturity. There are also hormones that can help hasten the transitional period to regulate our cycle, and those drugs are sometimes used in conjunction with the artificial lighting. If you're planning on letting your mare come in naturally, it's a good idea to track her cycle or write it on the calendar and watch for signs of heat. Note when you first see her in heat, when she comes out of heat, and how long her first cycle is. And then we can recommend bringing her in about 1.5 to 2 weeks after her first cycle of normal length. So I've already went through many of the details involved in breeding your mare. Now comes one of the more exciting or nerve-wracking parts of the process, the 14-day pregnancy check. 14 days is the best time to perform the first pregnancy check, as the vesicle is usually easily to distinguish by ultrasound at that time. We can also diagnose twins from asynchronous ovulations too, but it's still usually early enough to detect a mare coming back into heat in the case that she's not pregnant. As you can see from the picture, there's no embryo visible. At this point, it's just a black, fluid-filled vesicle. There's no way to tell whether or not this pregnancy is healthy or whether or not it will implant into the mare's uterus to continue growing. Nevertheless, this pregnancy check is very important, as diagnosing twins at an early age is imperative. A single twin is most successfully terminated before 16 days post-ovulation. Next, we have the 25-day pregnancy check. At 25 days, we can evaluate that the pregnancy is progressing normally and that there is a viable embryo present. A heartbeat can also be seen at this time. It also allows us to evaluate whether or not a twin reduction attempt has been successful. On the image, we can see that the embryo is at the bottom there of the vesicle, right there, laying on the bottom. The heart actually takes up a large percentage of the embryo at this time, so we are able to see it beating. It's also worth mentioning that 10% of pregnancies are lost before 40 days, and that's just a normal part of mare reproduction, so it's a good time to check if the pregnancy is in fact still progressing. The 35-day pregnancy check is sometimes performed if there's a question regarding the status of the 25-day heartbeat check. At this time, it's common to place a Caslix if it's required. If there's any possibility of twins, it's very important that a pregnancy check be performed by this stage, as after this stage, the placenta begins to take over maintenance of pregnancy, and the mare cannot be rebred that season, even if the pregnancy itself is terminated at that time. So now we move on to the 55 to 65-day pregnancy check. This is another pregnancy check that's not a common routine in all practices, but it's helpful in confirming normal pregnancy progression, making sure your mare is not one of the 10% experiencing early embryonic loss. At this time, it's also possible to determine the sex of the fetus. This area of study has really piqued my personal interest, and so we're hoping to offer this service in the future. Right now, I'm offering about a 50% accuracy rate, so it only goes up from there. So now that your mare is pregnant, what are you going to do about it? During the last trimester of gestation is actually when the foal begins to grow the fastest, and so this is when the foal begins to use the most energy. At this time, it's important to start slowly increasing your mare's plane of nutrition, which can include good quality leafy forage and a commercial concentrate for brood mares that has at least 12 to 14% protein. After foaling, she produces about 3% of her body weight in milk per day. And so it's important to continue raising that plane of nutrition until about 6 to 8 weeks post-foaling, when it's peak milk production. Always make sure trace minerals and fresh water are available. It's also important to have your mare up to date on vaccines prior to breeding. And those vaccines can be updated 4 to 6 weeks before she foals. There's one additional vaccine that is available, and this is against equine herpes virus 1. This virus can cause unexpected abortions in later stages of pregnancy. This vaccine is recommended at 6, 8, and 10 months of gestation. Deworming is also important, and as I mentioned before, she should be dewormed before coming in to be bred, at 2 and 6 months of gestation, and then 3 to 4 weeks before foaling. So, average gestation length is about 340 days, but a normal gestation length can vary from about 320 to 365 days. So this can be quite misleading. It also means that a seemingly normal gestation length can end up being too short for some mares and too long for others. I've listed some common predictors of how close a mare is to foaling, an approximate sequence that they usually happen. Of course, let me remind you that there are no absolutes with foaling. Mares have an incredible capability of being able to control their foaling to exactly when you go for a bathroom break. If, in fact, you are lucky enough to be there when your mare is giving birth, how do you recognize the warning signs if something is going wrong? A normal foaling usually happens in a process of 3 stages. The first stage of foaling is when the foal is positioning itself, and you may see the mare become quite uncomfortable. You may see her seclude herself, go up and down a lot, stare at her flank. She may also urinate more frequently, as there's lots of pressure on her bladder. But be careful not to confuse urination with the water breaking. The second stage is marked by the water breaking. This is the rupture of the chorioallantois, or the placenta, and it releases the fluid within, which is primarily composed of fetal waste. It's normally followed by the appearance of the amnion, the membrane surrounding the foal, in 20 to 25 minutes. If this takes longer than 30 minutes to appear from when the water broke, this is abnormal, and a vet should be called immediately. The third stage of foaling is the passage of the placenta, which should occur within 4 hours of the foal being delivered. The most problematic and potentially catastrophic problem is known as red bag delivery. This is when the placenta fails to break and begins to detach from the uterine wall and is seen before you see the foal. This is a very serious problem because the placenta is the source of oxygen for the foal until delivery. And without placental attachment, the foal is not receiving adequate oxygen. This is a true emergency, so it will be your job to break the placenta and pull the foal as quickly as possible. As interventions in foaling is quite time sensitive, some mare owners choose to let their mare foal out in the clinic, and so she's brought in and a foal alert monitor is placed into the vulva to help assist foaling prediction. The mare is also placed under video surveillance while in clinic. I like this picture. The most important things to watch for after your foal is born is known as the 1, 2, 3 rule, but I've changed it to the 1, 2, 3, 4 rule, as placental passage is also very important for the health and subsequent fertility of the mare. All of these things usually happen well within this time frame. So if the foal hasn't stood up by 1 hour, nursed by 2 hours, passed meconium by 3 hours, or the mare hasn't passed her placenta by 4 hours, it's a good time to call. A post-foaling exam is another important part of the foaling process. Foals are born very vulnerable and need that initial colostrum within 8 hours of being born. The post-foaling exam evaluates both mare and foal to make sure that everything went smoothly. The two biggest problems that we want to avoid are failure of passive transfer, which happens when the foal does not receive enough colostrum and therefore cannot mount sufficient immunity to its new surroundings. And the other problem is retained fetal membranes, or retained placenta, in the mare. For this reason, it's also very important that the placenta be kept for the veterinarian to evaluate during their visit. The IgG test can be done on farm and checks the foal's immunity levels to evaluate whether it received adequate colostrum. Sometimes when foals are born too early, too late, or something went wrong in the development process, we can see limb deformities in newborn foals. While sometimes foals can grow out of these, they can sometimes become a problem and are best evaluated early in life when they respond fastest to corrective interventions. Well, what a process! But you've managed to bring a wonderful little bundle of joy into the world, and you can't wait to do it again. Some owners choose to rebreed on their mares full heat, which is still a fairly debated issue in the reproductive world, but it's a common practice in some establishments. Our recommendations are to allow your mare to go through the first normal cycle and to bring her in about 14 days afterwards. Sometimes this can be a silent heat, so if there's any question as to whether she is in her cycle, we can either discuss using oral progestins or Regimate to regulate her, or bringing her into the clinic for an evaluation. Well, thank you very much for listening. I hope you found it very interesting. And a few of the take-home points are to start preparing the season before you want to breed your mare. If you have any additional questions about the whole process, I obviously love to talk about this, so feel free to call the clinic. Take care.